What's up, everybody? Just wanted to give you a quick update about a new project that's starting at one of our area hospitals. This project is mainly around STEMIs, how they handle STEMIs at their hospital, and how we can sort of expedite things and make things work smoothly for them. So first, I'd like to start off with sort of a review of our current STEMI care and what we should be doing to optimize what happens at the hospital. The first step probably with any STEMI case is identifying that that's what's going on with the patient. Sure, there's plenty of patients where we walk in the door and based on a few sentences in their complaint, we know that it's probably a STEMI. There's quite a few patients that don't typically present how we would expect them to. And so we want to make sure that we're including those patients that have that high index of suspicion that there might be a STEMI going on. Females, diabetics, elderly patients, also patients with a history, risk factors, smoking, high cholesterol, diabetes, all those things, hypertension. Those are all high risk factors for STEMI. So if they have any of these things, we want to make sure that we're getting a 12 lead very quickly with these patients. That is kind of the first step in getting this ball rolling, is getting a 12 lead and identifying that it is in fact a STEMI patient. So in those cases, when we get the 12 lead quickly and we do realize that it is a STEMI, what we want to do is notify the hospital as soon as possible. So one way we're going to do this is through a radio transmission. So we get on the radio, notify the hospital, and usually this is going to happen in the house at the patient's bedside right after we've gotten that initial 12 lead and have seen that there is a STEMI there. Get on the radio, notify them, hey, we've got a STEMI alert, we'll be transporting soon. We can call a full report en route, but we just want to let them know that we're bringing them a STEMI. The second step to that is transmitting the 12 lead. Now, if you are able to, the best case scenario is that you transmit that 12 lead as soon as you get it. I understand that you may not always have a connection, you may not be able to do that, but keep it in mind when you're in the house and you've gotten that 12 lead that you should at least try or see if you can transmit it to the hospital. If not, once you get to the truck, transmit as soon as you get in the truck and have a connection and are able to do so. When we do that, we want to include information on that 12 lead that can aid and expedite the registration of that patient to get them to the cath lab. So what we need to include on those 12 leads is the patient's first name, the patient's last name. This is fully spelled out, no initials, first name, last name, and their date of birth. Once that's transmitted over to the hospital and they see that it's a STEMI, they'll start working on registering and hopefully get the patient able to go to the cath lab as soon as you walk in. So there may be some situations where maybe they haven't received your 12 lead yet, or they weren't able to see the information they need. There may be situations where over the radio, the hospitals will ask you the patient's first name or last name or date of birth. This would happen over the radio. In those cases, when the hospital requests over the radio that we give them the patient's name or date of birth, we are able to do that. I know there's been some questions about, is that HIPAA compliant? We've checked it out and we would be able to do that. So if asked by the hospital and they need the first name, last name, date of birth, something to get that patient registered over the radio, we're able to give them that information. So the hospital that's kind of starting this up and the program they're starting is Baylor, Scott and White All Saints downtown. And so what they want to do is that if we're able to provide them all of this and sort of get the ball rolling, what you can expect when you get to Baylor, Scott and White All Saints is that in the ED, a CV clinician should meet you and verify that everything that needs to be done to get the patient to the cath lab is done. So usually they're going to check and make sure you have IV access, make sure the patient's gotten all the appropriate medications. And if all of that has been done, or if the patient's unstable, they may want to do some stabilizing stuff in the ED. But once all of that's done, you should be able to get that patient straight to the cath lab. The idea here with them, or what they want to accomplish, is getting the patient to the cath lab as soon as possible. So the initial stuff we talked about, the protocols, just general STEMI care, that applies to any hospital in the service area. But at Baylor Scott & White, you can expect that when you get there, if you have done all the stuff we talked about initially, there should be someone there waiting for you in the ED. They're going to verify a few things, and you should be going straight to the cath lab. So that's pretty much it. If you have any questions, we're all here to help, so don't hesitate to call, and have a great rest of your day. See ya.